It's Notes from No More Hygiene. Welcome, Dr. Nabors. And we have an update today on the groundbreaking research in the GAIN study. Why don't you remind us what the GAIN study is?
Right. So a few times back, if you didn't know this, the research between Alzheimer's disease and gum disease has been advancing at a very rapid pace. And we're trying to update with that pretty regularly because it's pretty fascinating what's happening. And the GAIN study is a clinical trial where they're testing almost 700 patients that have Alzheimer's disease. And they're testing them to figure out how bacteria from the mouth are getting into the brain, how that's triggering the brain to release a certain chemical called amyloid, and ultimately creating Alzheimer's and dementia type outcomes. And so for the scientific community, they're not researching this because they're trying to save teeth. The scientific community is researching this because they're trying to solve one of medicine's biggest mysteries, which is Alzheimer's disease and what causes it and how to stop it. And we correlate that many times with one of dentistry's most mysterious diseases, which is periodontal disease. And the whole once a perio patient, always a perio patient. And we know now what immunology does and how our immune system works and what happens and how destruction occurs through the body's response to the problem. And the same thing they're looking at in the GAIN trial is the same thing that's happening in the brain. It's the brain's response to these microorganisms coming from the mouth and entering the blood-brain barrier. And then the brain fights. And in this process of fighting, the brain begins to destroy the neurons. And it's groundbreaking research. And I didn't mean to go off on that, but that's
no, it's good background. So the most recent update this week,
yes,
is pretty remarkable. Tell us about it.
Right. If you are in kind of the business world and like that, the company that is building a medication to basically fight this body response and stop the accumulation of PG, Porphyromonas gingivalis, is a company called Cortisign, and it's a biotech company, and they are the ones that are using the information from the GAIN trial to build a medication. And so they're in the phase 2 out of 3 phases of the GAIN clinical trial. The update just came out yesterday yesterday, it was August the 30th is when the update came out. And basically what they found in the GAIN trial, that every participant in the GAIN clinical trial in people with Alzheimer's disease showed evidence of infection by Porphyromonas gingivalis according to their new analysis. And that supports a direct correlation between a Porphyromonas gingivalis infection in the central nervous system.
Wow. So it's every single
one. Basically, it's going to tell you that out of 638 active participants with available data, all tested positive for antibodies against P. gingivalis in their blood. And now the way they're referring to this now is a type of they're calling it P. gingivalis, a type of bacteria best known for causing periodontal disease and Alzheimer's.
Wow,
is what they're saying. So it's crazy. But another piece of language that they're using that I noticed is that they're supporting this evidence that P. gingivalis is not just an infection of the brain, but it's an infection of the central nervous system.
So that's everywhere.
That's a big step. Not that brain's bad enough, but I think we have to look at language in medicine. And when they're talking about building medications for a central nervous system disease, we might look at that a little bit differently than if someone's, gum tissue's bleeding when they floss.
Right. Yeah. Whole different perspective.
Yeah, I mean, it's a new ball game. And I think, we take for granted. I think so many health risks have been right under our nose the whole time, pun intended. And I think that's what medicine is figuring out.
Yeah. Great update. And it continues to change not only the conversation, but it also changes the way and the perspective that we look at periodontal disease and how critical it is to treat the disease, cure it, and it saves lives, and which we continue to say. So thanks, Dr. Nabors, for the update. We've included the link to this latest research with this video so that you can read all of the updates. And again, one more reason to be implementing modular periodontal therapy in your practice so you can save lives, literally. And today, now we know Healthy, give you a healthy nervous system, a healthy central nervous system.
That's right.
Great
Everybody check that out. It's fascinating new research. So thank you.
Excellent. Thanks, Dr. Nabors.
All right. Bye-bye.